once every 5 years, or, I mean, it doesn't do you any good.
It doesn't do you any harm.
It doesn't do you any harm.
And that's the question that came up before with having a discussion with one of the, I believe, the pharmacists in the back. Why is it only one shot after you're 65? And I think the only answer I can give to that is that there's no data that even that is available to evaluate the effectiveness of more than one shot, especially, and I know this hurts because I are one, in older patients with weaker immune systems. It's not to say if your physician, if you're in a high-risk situation, he wants to give you pneumococcal vaccine. There's nothing wrong with that.
Well, that's why I asked, because, and I'm not 65, and I was having pneumonia year after year after year, up until about 3 years ago, and my pulmonary doctor was requesting that I have one every single year.
That's not going to hurt you. As long as, the serotype that is covered, that it's not 100%, surely.
Right.
And it just depends on your immune, and that's so much true with all of the vaccines. As we get older, flu vaccine is going to respond maybe better in this lady than it does in me. But it's the same vaccine. It's just our immune systems aren't going to respond as well. Yes, ma'am. There are, the question was, and this is another pet peeve. I don't know if there are any anti-vaccine people in here, but too bad if there are. We have an ever-increasing issue here in the Commonwealth and all over the country where you see Jim Carrey and God knows who else get on television and say vaccines cause autism. Don't vaccinate your kid, or your kid can't handle all these vaccines, spread the vaccines out. We now know that autism and vaccines are not remotely related. That's, anybody that brings that issue up now is not keeping up to date. I feel sorry for folks with autistic children. I just wish we had spent the money trying to prove vaccine causes autism on autism research. But we didn't. Mothers and parents, there's an increasing number of parents opting either not to vaccinate their children or to not to vaccinate their children in accordance with the schedule. Lots of reasons for that. Some of them are afraid of the vaccines. They think they don't want to put it in the kid's body. There's just a whole host of reasons. Many of them, most of them are not credible. But that's a parent's right. Give you an example of what happened this year, this spring, in Virginia, in a county in Virginia. We had, I guess you'd call it a community. And it was a community of very well-educated folks who were primarily anti-government, but they, as a result, were also anti-vaccine. Had none of their children vaccinated. The whole community had virtually all of the children got pertussis. One death. The surrounding community that wasn't part of this group also started to get pertussis. My point is, as long as the under-vaccinated children or persons are in the general population, they benefit from herd immunity. Because more people are vaccinated, it's more difficult for the disease to be transmitted. It's when that herd immunity breaks down, these groups of people who are anti-vaccine get in a group. And many of them are religiously exempt, some of them are philosophically exempt. But when they get in groups, that herd immunity breaks down. And some would argue, what right do you have to put my children at risk because you don't want to vaccinate yours? So there's a whole political argument, legal argument that we don't need to get into here, but I think autism is not caused by vaccines. There's really no evidence to show that children cannot take 3 or 4 vaccines at a time, and the risk to disease still does exist, and that's part of the problem. immunization has been one of the most effective medical procedures in history. And we've almost vaccinated ourselves out of a job. That's a good thing. But when people, including physicians, have never seen these diseases because they've been eradicated, or theoretically people think they're eradicated, they're not eradicated. They're only, they can't be spread in a well-immunized population. Measles, we haven't had a case of measles in several years. But as long as there's an airline flying back and forth from England, from India, from Pakistan, all of our cases of measles that we've had over the last 7 or 8 years have been foreign imports. That's why we have to stay vigilant. Yes, we don't have endemic measles. But the opportunity to be infected with measles happens every day. At Richmond Airport, Dulles Airport, riding on a plane. Every year we actually follow up on manifests from airlines giving us the people who are on a plane with somebody who had measles. We have to follow everyone. It costs us hundreds of thousands of dollars a year to follow up with these people. But it's something you're obligated to do. These people need to know that. Any other questions? Well, I thank you very much. I know it was painful, not only my call. I found it good. Let's talk a little bit longer.